And blood pressure is, because of it is basically age related. We say 95% of patient will have no cause of blood pressure. We say it is kudrat, we say it is natural because of the genetic makeup in our body. And there are certain cases, those patients who are obese, those who smoke, or those who take a lot of cholesterol, they are more likely to have the blood pressure or high hypertension in the future. And those patients who has family history of blood pressure, they are likely to develop blood pressure. And a very important part to control is the lifestyle modification. I am telling you, the lifestyle modification is the number one thing. It includes the dietary, reduce your salt intake, no salt on, no table salt, exercise at least 3 to 4 kilometers per day, walk 3 to 4 kilometers, lots of fluids, eat regular vegetables and fruits, avoid the junk foods, fast food, reduce your weight. If you are overweight, reduce your weight. These are very important. 50% of your blood pressure will get better if you do all these things. Thank you. Hello friends, I am Dr. 𝐍𝐞𝐰, Director Cardiology, 𝐍𝐞𝐰 Hospital. Today we will discuss high blood pressure, hypertension. The hypertension is actually very common in the population, and most of the time it goes unnoticed. There are very few patients. The science says only 10% of hypertension patient will have some symptoms like headache, uneasiness, difficulty in vision. So only 10%. 90% of patients will never know if there is a high blood pressure. Actually, most of the time when the patient goes to a doctor for some other reason, or the patient says, let me check my blood pressure, and he sees that the blood pressure is high. That is how maximum number of patients get diagnosed of hypertension. So it is very important, and one should always check blood pressure at a certain interval of time. After the age of 30 or 35, 40 years, one should regular check his blood pressure after 1 or 2 months. And those patients who have the family history, whose mother, whose father or whose brother is having the blood pressure problem, he should always be careful about the blood pressure checking. And if you have the blood pressure, then it is very important you should consult your doctor, take proper medication. The more important is reduce your salt intake, improve your diet, reduce your weight, exercise, walk more, and take medication at a proper time. That is very, very important. Thank you. Hello friends, I am Dr. 𝐍𝐞𝐰, Director Cardiology, 𝐍𝐞𝐰 Super Specialty Hospital, Faridabad. Today we will discuss which is better, angioplasty is better or CABG is better. Look, there are different subset of patients. Angioplasty is better in patient in whom the blockages are small and whom the blockages are only in 1 artery or 2 arteries, maximum 3 arteries. And depending on the length of the blockage, if there is calcification or not, if there is a diffuse long disease or not. So in these cases, where the blockages are small, there are only 2 to 3 blockages, important is to go for the angioplasty. And bypass or CABG is important in those patients who has long blockages, all the 3 arteries are blocked, there are so much of calcification, so much of calcium in the blockages. So in that cases, the CABGs or bypass is better. Definitely, if the blockages are long, if we put more number of stents, long stents, then the reblockage is common in the angioplasty patient. But mind it, in surgery also, there are 10 to 15% of chances that the graft will block after 1 year, and the surgical life is almost 10 years. But in younger patients, angioplasty is little better. In the older patients, the bypass is better. Thank you. Hello friends, I am Dr. 𝐍𝐶𝐰, Senior Cardiologist, 𝐍𝐞𝐰 Hospital, Faridabad. So we'll discuss important device that is called CRT-D or a combo device. Basically, CRT-D is used in such patient whose heart pumping is very low, and in certain patient in the ECG abnormality shows LVB. So we have to choose patient whose heart functions are low and the echo parameters and ECG parameters are good for the implanting the CRT-D. Basically, CRT, what does CRT-D do? CRT-D device has 2 devices, CRT and D for defibrillator. So this device improves the heart functions, and at the same time it prevents you from the sudden cardiac death. because in patients who has low heart functions, low heart pumping, the risk of sudden cardiac death is more, and the heart functions with CRT, the heart functions gets better with this device, and it is a very small sort of a device. The surgery takes only 1 hour, and it is a conscious sedation. There is no general anesthesia, and the hospital stay is only 3 days. And we have been using the best of the devices in our hospital, that is US FDA approved, St. Jude, Medtronic and Boston. All 3 devices are the best in the world. So we use all these devices, and it is very safe. Almost we can say the success rate is more than 95%. Thank you. Okay. So in our hospital, we normally use the best US FDA devices. It can be from the Boston, or it can be from the Medtronic, or it can be from the St. Jude. They're all one of the best in the world US FDA devices, and it is not a big operation. It is a very simple sort of a surgery. There is no general anesthesia, only a small nick is given in the chest, and a device is put here, and the lead goes inside. And normally the hospitalization is only for 3 days. There is a small stitches that is removed after 10 days. So patient can be mobile. Next day he can walk and all. There will be a dressing that is done after 3 to 4 days, and on 10th or 11th day we remove the stitches. So it is a very simple surgery. There is no problem about it. Thank you. Hello friends, I am Dr. 𝐂𝐨, Director Cardiology, 𝐴CORD Hospital, Faridabad, India. So today we are going to discuss very important thing, ICD. What is ICD? ICD is basically intracardiac defibrillator. It is a small device, or you can say it's type of a pacemaker, which is implanted in the left side of the chest under the skin, and the lead goes inside the heart. Basically, ICD, what is the role of ICD? Why it should be done? There are certain patients whose heart pumping is very low, either because of the heart attack or because of the blood pressure, long-standing blood pressure. The heart has become weak. Heart pumping has become less than 30-35%. Normally the heart pumping is 60%. When the heart pumping is very low, there is a chance of sudden cardiac death or cardiac arrest. So in that case, you have seen in Western world, there is a shocking device implanted in the market, in the mall, everywhere, so that if the patient have any sudden cardiac death or a cardiac arrest, so you can immediately give the shock. So ICD is basically recommended in those patients whose heart functions are low, and in whom the risk of sudden cardiac death or cardiac arrest is very high, so that it immediately senses it and give a shock inside, and it can give a new life, or it can prevent you from the death. Thank you.